Welcome to BW Healthcare World. And, today being the World Brain Tumor Day, we are having a conversation to understand what exactly is tumor, how is a brain tumor different from any other tumors, what is the impact that it will have on our lives, what are the technology advancement that has taken place. My name is Harbinder Narula, and I have with me two guests who are Dr. Atul Prasad, who's the Principal Director of Neurology, Neurosciences, and Interventional Neurology at the BLK-Max Super Speciality Hospital in Delhi. And joining us is Dr. Ishwar Chandra Premsagar, who's the Chief of Neuro and Spine Oncology Services at the Rajiv Gandhi Cancer Institute. Let's speak to them to get insights and understanding on brain tumors, advancements, and treatments. Thank you so much, Dr. Prasad and Dr. Premsagar, for joining us today.
Thank you for inviting us.
Dr. Chandra, Dr. Premsagar, let me just begin with you in trying to understand what exactly is a tumor. When somebody says that the patient has a tumor, what do we exactly mean by that, sir?
When there is a cell in the body, which is the unit of the body, and when there is wear and tear, it repairs itself. A new cell comes up. But when this growth of the cell, division of the cell is uncontrolled, it behaves like a tumor, then it becomes cancer. So, and then it takes the food and it starts pressing on the surrounding brain. So that causes the problem, because brain is a very important structure. It takes the blood supply and it grows there in a small space, which is meant for the brain only. So it occupies that space also. It causes increased intracranial tension, which has got its own symptoms and signs. So that is how the brain tumor is. So it can be benign brain tumor or it can be malignant.
Right. Dr. Prasad, how does one even come to know that they need to go test for a tumor? I mean, are there any symptoms that somebody feels, something that people should look out for and be concerned of and go and get themselves diagnosed? So what are the symptoms that people should be looking out for in case of a tumor being present in the body?
So that is quite a challenge sometimes. They can come with very non-specific symptoms. They may just come with headache, little bit of nausea, little bit of memory disturbances, which are non-specific. And they may point towards something in the brain, a growing mass in the brain, or they may not. They may not. So that can be a challenge. But usually when something starts growing in the brain, we expect the patient to have two or three things. One is raised pressure symptoms in the brain, headache, vomiting. Second thing is, depending on where the tumor starts from, we can get visual disturbances, we can get weakness of one side of the body, or numbness of one side of the body, difficulty in walking, difficulty in balance. So it can be non-specific or it could be very specific to the brain, and that sometimes that can be a challenge to know when to investigate, who to investigate, which doctor to show. They don't always land up with a neurologist or a neurosurgeon.
So, I mean, I'm going to take a cue from there itself, what you just said, because typically if somebody is getting a headache, it would never occur to them initially that, it could be a tumor. And is there any specific kind of a headache that a person should take notice of?
A new onset headache, a recent onset headache, especially if accompanied by vomiting, should not be neglected. It can be nothing. It could be something as simple as migraine also, but you must show a doctor, must get yourself examined and make sure that the doctor rules out a tumor irrespective of age or sex.
And Dr. Premsagar, when somebody goes with these kind of symptoms and there is a sign that there could be a tumor, what are the typical diagnostic tests that are done on a patient to identify or rule out the presence of a tumor?
Before going to the test, we see the patient and examine the patient. That itself at times tells you that the patient might be having increase in their brain tension. There are definite signs, because you see papilledema, swelling of the optic disc if you peep into the eyes. So that is a very important sign there is something going on. Or there is a weakness on half of the body, or other disturbances, other cranial palsies. So after seeing that, we start suspecting that where there may be a tumor and which part of the brain may be affected with the tumor. That also we have some clue after examining the patient. Then we have battery of tests. One most important is MRI, magnetic resonance imaging. That tells you. And apart from that, then after MRI, we know that whether it is primary or secondary tumor, it is a benign tumor or malignant tumor. If we suspect there are multiple tumors in the brain, then we suspect this is a primary somewhere else in the body and it has thrown up different types of satellites into in the brain. Then we ask the patient to undergo PET scan. PET scan is a scan which shows whole of the body. This is
Right.
and the nuclear dye is used, and then we find where is the primary, and then accordingly we do other battery of tests depending upon what is needed for that particular tumor in that particular patient.
And sir, Dr. Prasad, are there different kinds of tumors that are there in the body? And how do you differentiate between one tumor from another, and specifically when it comes to a brain tumor?
Yeah, of course, any part of the body a tumor can develop. In children,
Yeah.
for example, you can get blood cancers, leukemias, lymphomas. In adults, you can get cancers of the lungs, or the breast, and the abdomen. Tumors can occur anywhere in the body. Number one, you need a high index of suspicion. High index of suspicion, depending on the age, depending on the history, whether there's a history of weight loss or not, how the appetite is. And once you diagnose, whole body PET scan is a good test for picking up or telling us where the primary lesion can be. The next step is biopsy. Next step is a biopsy. Now, this is very important to remember. There's a lot of myths about cancers. All tumors or all swellings are not cancerous. They're not cancerous. You would need a biopsy to make sure whether it is cancer or a cancer mimic, something which looks like cancer but is not a cancer. It could be infection or it could be a benign tumor. Even in the brain, you have benign, like Sir said, like Dr. Premsagar said, all lesions, all tumors in the brain need not be cancerous. They need not be malignant. We can have benign lesions also. For example, a meningioma, which is benign. And a biopsy will sort it out. A biopsy will help you to sort it out whether it is benign or whether it's malignant, because your whole approach, your whole treatment changes depending on whether it is cancerous or whether it is not cancerous.
Dr. Premsagar, I mean, you're working in an institute which is focused on cancer treatment, oncology. How many cases of tumors that are being found are actually cancerous? Do we have some stats on that, sir?
In India, it is seen that the incidence of the tumor is 5 to 10 per 1 lakh population.
Okay.
And out of all tumors, it is 2% involves the brain.
Okay.
So, and this is growing day by day. It may be because of pollution or other factors, or because of increase in population. So incidence is increasing in India.
And also, are we seeing an increase in the number of tumors being found because of more and more people going in for diagnosis now than ever before? Or is it because there is more tumors happening today?
Right? Both are correct. More tumors are happening today because increased population and because of other factors. And also there is a more awareness. And we have got investigations which are now easily available. With 10 years or 20 years back, MRI was hardly few centers. Now there are more than 100 centers in Delhi, and they are easily affordable as.
And so you were talking about, depending on the kind of a tumor that is there, which part of the body, there are treatment options that are there. Now, specifically when it comes to a brain tumor, what are the different treatment options that are available today? And what are the basis of choosing what treatment to go for?
Now, for the brain tumor, again, we need to find out where is the brain tumor and what is the nature of the brain tumor. So, if it is a benign tumor and if it is easily approachable and the patient can, body health-wise, we can get the surgery done, then it is better to take it out total. And if it is benign tumor, this is curable. Nothing else has to be done.
Dr. Prasad, would you like to take this
So
forward, sir?
we have three modalities of treatment. One is surgery, second is chemotherapy, and third is radiation or radiosurgery. or gamma knife, or by different names it's known as. You choose the of the three, you choose surgery or radiosurgery or chemotherapy, depending upon number one, location of the tumor, whether it's easily accessible, whether you can take it out or whether you cannot take it out. Second is the size of the tumor. Smaller tumors can be burnt with radiosurgery. You need not to try to take out the whole thing, and with or without chemotherapy. So number one, location of the tumor, the difficulty, surgical difficulty in approaching the tumor. Second is whether it's radiosensitive or it's not radiosensitive. And third is the condition of the patient. Obviously, a very elderly gentleman, maybe in 80s or maybe in 90s, who has multiple problems, a heart problem, a kidney problem, you would not really be keen to subject him to very extensive surgery. A surgery just to reach a diagnosis and then take it up from there. Benign tumor, surgery is enough. Malignant tumor or cancerous tumor, you would like to follow it up with chemo or with and with radiosurgery, that is gamma knife, or focused radiation into the brain.
And so, what are the chances of people getting cured of the brain tumor? I mean, how many are there? What percentage of people face long-term issues related to the outcome of this particular problem that they face?
So I think the Premsagar is still off the radar, so I'll continue. So survival rates depend on the type of tumor you're dealing with. For example, a low-grade glioma, 5-year survival rate is 60 to 80%. So all tumors, all brain tumors do not die. Very important. All of them do not die. A high-grade glioma, the one which is glioblastoma multiforme or the very malignant type, there the survival rate is poor. 5-year survival rate is approximately 10 to 15%. That means approximately, unfortunately, approximately 80 to 85% will be dead at the end of 15 years, at the end of 5 years. Pediatric tumors, the tumors in children by and large have a better prognosis. For example, a medulloblastoma, a brain tumor found in children, has a 5-year survival rate of 70 to 80% with aggressive treatment. The second question was, after survival, was quality of life, that if they survive, what are they left with? And again, it depends on what the patient is presented with, whether the patient may have residual memory problems, residual cognitive problems, thinking problems. And that is where they need a lot of emotional support, a lot of cognitive rehabilitation, a lot of physiotherapy, a lot of social support for them to battle and come out of this of a brain tumor.
Got it. Dr. Premsagar, let me come to you. We were just discussing the kind of treatment options that we have in case of a tumor, and specifically brain tumor. But, since we're talking of brain, it impacts the functioning of other parts of our body, and even after treatment, do you think that the functioning of the body does get affected when somebody is detected with brain tumor?
Now, when the patient comes with the problem, when the functioning is already affected, and we have to make surgery, if it is a benign tumor, surgery is the best option. If it is possible, if old age, because the patient cannot tolerate surgery, we have got radiation treatment. The benign tumors. We have got a cyber knife, which we have, is the only one in the city of Delhi, which is robotic radiotherapy. So we can burn very precisely. That is for the benign tumors. But when it is malignant tumors, then if it is very deep-seated, we do stereotactic biopsy, take out a small tumor. And this all we do without any increase in deficit of the functional deficit of the patient. So our aim for surgery, for any treatment, is do not give additional deficit if you're not able to improve the deficit patient already have. So if the patient has got deep-seated lesions, we do biopsy and accordingly we treat. And if it is a tumor where we can easily go and take it out, we do surgery. And depending upon the biopsy report, then further treatment is given, radiation or chemotherapy or both together. So your question was that whether the patient will improve of his functional problems. Yes, many times the patient can improve, depending upon what type of tumor, where it is.
Okay. My next question is to either one of you. You can choose who wants to go in first. So we are living in a country where there's a inequitable distribution of healthcare access. And we know that the three pillars of healthcare are the access, the quality, and the affordability. How is our country poised or positioned to offer treatment uh, for brain tumor compared to the global stats? Do you think we have enough doctors available in the country? Do you think the services are equally available across the country? And what is it that you think the government needs to do to support the treatment of brain tumors in our country?
Now,
Dr. Premsagar, Dr. Premsagar, please.
brain tumor surgery. I was working before as the head of neurosurgery in Ramanolaya Hospital, which is government hospital.
Right.
So there we were well equipped, but whether that is totally free to every patient.
Yeah.
However, the burden of patients are too much there. So there's a long
Mhm.
waiting list. And now I am working in a private setup where the patient can afford, then he can get operation. We don't have a waiting list there. Now, for very poor patient, we have EWS quota, economically weaker section. So we operate, we give the same facility to the weaker persons and as to the person who can afford it. However, uniformly in whole of India, it is not, the facilities are not at everywhere.
Yeah, see, there's no doubt we are in India, we are in a developing world. Delhi is Delhi, but there's places outside Delhi. India is outside Delhi also, and there is definitely facilities are not so easily available to everyone. So there is a problem of access. There is a problem of funding. There's a problem of affordability. Uh, this is where the government and the private should have a partnership. Should have a partnership between the government and the private. You should leverage the strength of both the sectors. The private, you need the input of a private, the skills of a private, the funding of a private, and the resources of the government to make this available all over India. You cannot work alone. It's not enough to have Rajiv Gandhi in Delhi and Tata Cancer in Bombay. It's not enough. You need more work has to be done if you want to make it available pan India.
Right. And also, one of the crucial role that the healthcare system actually creates an impact in the industry is the research. What do you think is the role of government that plays in funding the research for brain tumor treatments? Are there any specific government grants, programs dedicated to brain tumor research and finding newer treatment possibilities or improving the treatment possibilities? Do you think India is doing enough, or there's something more that can be done? And also, Dr. I'm going to
Something
take a
more can
cue
be
from
done.
what you just said, that there has to be a collaborative approach between the government, the research institutions, academic institutions. Do you think that is happening?
It's not happening. I think it's not happening. The government needs to increase the GDP for health. For health, it needs to remember in children after leukemia, brain is the second commonest tumor, second commonest site for tumors. The problem is there. The problem exists. The government needs to do more. The awareness should be there. There should be pooling of resources, expertise, innovation from both the public sector and the government. Whether it's happening or all the funding is going only to aims and demands, I don't know. I don't know. There should be collaboration in research. There should be collaboration in artificial intelligence, robotics at both levels.
Yeah. Dr. Premsagar, what would you like to say about this? You worked with the, RML.
Government.
You're now working with the Rajiv Gandhi Institute. What do you think is the missing piece? What needs to happen?
See, in RML hospital, we used to get grant from the ICMR, from different government institutions. But now in Rajiv Gandhi Cancer Hospital, we don't get those grants. So we have to afford our own research. Though we are doing research, but it cannot be unless there's funding is there.
Where's the public-private partnership there? The private is on their own, the government is on their own. All the grants are going to one or two institutes.
Absolutely. And sir, that brings me to the next question. When there is a dichotomy where we are talking of public private partnership, and here we are experiencing that private is working on its own and the government is working on its own, and they have their own working styles and their own independent silos. What is the affordability for treatment? What percentage of people who are deserving patients but cannot afford treatment? What is your estimate about that?
You see, there are large population which need treatment, they cannot afford treatment.
Mm-hmm.
See, I belong to a small town in UP, in Hardoi. I go every
Mm-hmm.
fourth Saturday there and visit and give my services there. There are so many patients, the brain tumor come, they cannot come and get operated in the Rajiv Gandhi Cancer Hospital. Many of
Mm-hmm.
them we put it in EWS quota. Some of them can afford, we can reduce our price to half, but still there are many remains.
Mm-hmm.
The
Right.
government institution has to do it.
And Dr. Prasad, when we look at the advancement of treatment, I mean, with AI being there, how is artificial intelligence being utilized to improve the diagnosis of brain tumors in pediatric patients specifically? Because, an elderly person can still go and explain that they're getting a headache or the symptoms, but a child typically does not know what the symptoms are and he's not able to explain to the parents. What are the benefits of using AI algorithms in detecting early signs of brain tumor through imaging
AI,
techniques?
AI in neurosciences is big. AI and big data are going to be the future of neurology in various ways. Number one, in
Mhm.
diagnostics, AI-powered imaging analysis. Now, analyzing MRI and CT scan, what is currently happening is the radiologist sits in front and looks at the images. Now,
Mhm.
imagine an AI or an algorithm looking at it, and we know that we can detect tumors at an earlier stage and differentiate the different types of tumor much earlier than the human eye does. So imaging AI is far ahead of us. Number two, predictive analytics, prognostic models. So if we have patient symptoms, the MRI models, the general data of the patient, the AI can tell us, it can guide us in individual treatment plans.
Mhm.
Treatment plans, it can tell us about the recurrence rate. It can analyze
Mhm.
the patterns. The AI system can analyze patterns to predict the likelihood of tumor recurrence, making us our treatment more proactive. We can get
Mhm.
precision medicine, that is integrating genetic, molecular histopathology, and clinical data to have personalized treatment.
Mhm.
It is not one glove fits all. Okay?
Mhm.
So AI can help us in diagnosis. AI can help us in choose a particular modality of treatment. AI can help us in follow-up of the patient and
Mhm.
prognosticate about his quality of life, prognosticate about his duration of life,
Mhm.
if as and if required, and tell us to be one to watch out for. So it can help us
Right.
in every part. AI is the future in neurosciences, in
Right.
all medicine.
Right. And Dr. Premsagar, today there's a lot of influx of genomic studies. Now, people who have had tumors in the past, do you think this is getting passed on hereditary to their next generation? And if so, do you think genomics is an option for them to go forward? Since we are talking of predictability of, predictability creating an opportunity for prevention, do you think that is a reality?
For molecular testing, genomic testing, what I mean, there is not has been the brain tumors are usually not inherited, except few
Okay.
neurocutaneous brain disorders in which
Mm-hmm.
brain tumors are inherited. They are not inherited. However, we use this molecular testing for the treatment.
Mm-hmm.
We do molecular testing for the brain tumors and find out what treatment is best. We do different types of treatments. So
Mm-hmm.
therapy we do by this. There are different types of treatment which are focused to the tumor cells. They do not kill the normal cells of the body. So that is how we can use it. We do NGS, next generation sequencing, and many of
Mm-hmm.
our patients, one of the patients of glioblastoma, which usually survives for not more than 2 years, is still surviving and he's doing his work. He
Mm-hmm.
was operated in 2021 at Rajiv Gandhi Cancer Hospital and he is working fine. So we can utilize this molecular testing for the treatment.
And
And so,
prognosis.
Dr. Prasad, we understand that having a brain tumor does not mean that the next generation may be having it, but the tendency of having a tumor itself, is that something that could be there because of the past generation having tumors?
You see, it's like this. What causes brain cancer, tumor? Not only brain tumor, anywhere in the body. I think it's a mixture of two things. There is a genetic predisposition, and then there is the environment. Okay, and how much each of them is important is depends on your luck or depends on your bad luck. So if I have a tumor, will my son have a tumor? The answer is you. Just Dr. Premsagar quite correctly said, you do not inherit a tumor because it's much more complex than just passing on a particular gene to your son or to your daughter. So if a person has a, in fact, that's one of the misconceptions that if my father had a tumor, I will have a tumor. Some of them are inherited. Colonic cancer, GI cancer tumors, yes, they are. Brain tumors, by and large, no.
Right. And Dr. Premsagar, since we are talking of AI technology creating an impact in the treatment of brain tumors, the other ethical considerations that come into mind are the data, protection of data that is there. How is patient data privacy being protected in development and deployment of AI in healthcare, specifically in institutions where there's a huge inflow of patients coming in, and that could be the basis of the research that is there?
So AI is a future, of course, but it has not been utilized till date in neuro-oncology. I do not know of any center in India who is using it, but I hope it should be done. But data protection is very important because nowadays everything is online. So we have got a huge department for the data protection only.
Right. And Dr. Prasad and Dr. Premsagar, any one of you, in fact, both of you, what is your comment on where are we headed when it comes to development of the treatments, the advancement that is happening? Is there something which is being researched, currently being worked on, that we can expect to see as a a path-breaking treatment for brain tumors anytime soon?
You see, the most common brain tumor is glioblastoma. Now people are trying from decades, because this is one tumor which is most common and which is very deadly. So still people are trying. There is some success as well, but we do not know when it is going to be uniformly successful.
Right.
I have my thoughts on emerging trends. I think the future, I'm for technology. So I think the future is going to be personalized medicine. Genomic and molecular profiling of tumors will pave the way for personalized medicine. Immunotherapy and targeted therapies are becoming more prominent. So immunotherapy, we can look at the immunological, the vaccines which are coming up for tumors. Technological advancements are not only for diagnosis, also for treatment. So surgical techniques, minimally invasive techniques, robotic surgeries, which are coming up, advances in interpreting the functional MRI and PET scans, which will help us for early diagnosis. I think AI and machine learning algorithms will be used to analyze complex data sets, aiding in early diagnosis, early treatment planning, and predicting outcomes. I think long future belongs to robotics and AI.
And Dr. Prasad, let me begin with you. What is your message to the people in general and also to the practicing specialists on this World Brain Tumor Day?
So I think I have many messages. Number one, all brain tumors are not cancers. Remember the first line which Dr. Premsagar said, they can be benign. Tumors can be unregulated growth of cells, but they can be benign or they can be cancerous. So all of them are not cancerous. That's number one. Leave it, let the doctor decide and guide you which is which. Second is all brain tumors are not fatal. This is another misconception that every time you diagnose as a brain tumor, so ulti ginti start over. It's not true. All of them are not fatal. Third is brain tumors can present with very subtle signs and symptoms and they need not come with very severe symptoms all the times. So if there's anything which should not be happening to you, it is time for you to go for a checkup. To go for a checkup. Next is, all tumors, brain tumors, need not go for surgery. Like Sir said, Dr. Premsagar said, there is an option of gamma knife. There's an option of radiosurgery. Some of them can be treated only with radiation. All of them need not undergo surgery. One just in a lighter vein, a lot of people think that mobile phones can cause cancers. Okay, so we don't know. The answer is we don't know with the mobile phones. So far, WHO has said that we can continue to use our mobile phones, and we do not really have a cause and effect relationship of mobile phones and cancer. Brain tumors are not contagious. You have a brain tumors, you will not spread it to your children, you will not spread it to your wife. Continue. You need social support, you need family support. Do not isolate yourself that they can be contagious. These are the important messages, I think, on Brain Tumor Day. We should go out to everyone.
Dr. Premsagar, the last word from you. What is your message to the people and also to the medical fraternity that is working on brain tumors, sir?
So early diagnosis is very important. If we have any doubt, must get investigation done. And when it is diagnosed a brain tumor, so it is having brain tumor, it does not mean your life is dismal. Or majority of brain tumors can be treated. There is also myth that if you touch the brain tumor, it is going to spread. That is not true. It can be taken out and the patient can be improved, and majority of the tumor can be treated properly. Surgery is very safe. Nowadays, we do surgery with awake craniotomy. The tumor is at the speech area. We ask the patient to talk while we are taking the tumor out.
Fantastic. Dr. Prasad and Dr. Premsagar, thank you so much. I think, it's a very, very strong message to the people who have a lot of misconceptions on brain tumor. Especially, I think the message is absolutely clear that if you have any symptom, even if it is small, go get yourself tested. It's better to investigate and rule out. That should be the intention than to be worried and wait until it becomes difficult to treat. And this is I think what is going to lead to what Dr. Prasad and Dr. Premsagar, both of you in your conversations have brought out very subtly, that having a brain tumor does not mean it's the end of the world. In fact, it is good to go screen yourself, find out, and have an attitude that, if I have a problem, there is also a solution which is available, and which is a safe solution which is available. So go get yourself tested. If there's a problem, treat it. Change the mindset or the way you think towards having a brain tumor. It's not the end of the world. I think that's a very strong message. Dr. Prasad and Dr. Premsagar, thank you so much for taking out time to make this conversation really valuable. Thank you so much.
Thank you for inviting us once more. Good night.